Now let's look at the high-flow devices. These provide sufficient flow of gas to meet all of the patient's minute ventilation requirements. Let's look at when a high-flow device might be more appropriate. Patients with chronic lung disease and CO2 retention whose ventilation is dependent on hypoxic drive. This is an overemphasized condition in which the usual stimulus for respiration, maintenance of a normal CO2, is lost due to chronically high CO2 levels. Respiration is then driven by hypoxia. If high concentrations of oxygen are given to these patients and their PaO2 goes up too much, this hypoxic respiratory drive can be lost. Hypoventilation may occur and the CO2 will become very high, causing coma and possibly death. In this instance, a high-flow device in which the oxygen concentration can be carefully controlled and guided by blood gas measurements is more appropriate. The inspired oxygen concentration is determined by the design of the device and not by the patient's rate and depth of breathing. Clinically, Venturi devices are used to increase gas flow to the patient because air can be entrained using the Venturi principle. These devices can be used to deliver accurate oxygen concentrations by mixing air with oxygen. High-flow devices maintain a constant delivery of inspired oxygen concentration throughout the respiratory cycle. Masks are available which deliver a single concentration of oxygen, for example 24%. These are also available with interchangeable color-coded Venturi valves for different concentrations. When using a Venturi mask, select a Venturi valve of the prescribed oxygen concentration and attach it to the mask. Attach one end of the oxygen tubing to the valve spigot and the other end to the oxygen flow meter. Set the flow meter to the flow indicated on the valve. Place the mask over the patient's nose and mouth and tighten the elastic to obtain a secure and comfortable fit. If the mask has a nose clip, it should be pinched to provide the best possible fit. Caution: at oxygen requirements above 40%, the valve may not generate enough total flow to meet high inspiratory demands. There is a widespread misconception that the oxygen concentration varies with the oxygen flow rate. If the oxygen flow rate is increased, the total flow to the patient is increased, but the concentration stays the same. Fixed Venturi valves can also be incorporated into oxygen recovery T-piece kits. The most popular is the 40% valve. These are used to provide spontaneously breathing intubated patients with supplementary oxygen during transport and in the recovery room. Connect the T-piece to the 15mm connector of the tracheal tube or laryngeal mask airway. Attach one end of the oxygen tubing to the valve spigot and the other to the oxygen flow meter. Set the flow meter to the flow indicated on the valve. A disadvantage of fixed concentration Venturi valves is that in order to change the concentration delivered to the patient, it is necessary to change the valve. This can be overcome by using an adjustable Venturi valve. With an adjustable Venturi valve, the rotation of the sleeve increases or decreases the size of the air entrainment window. This in turn changes the oxygen concentration. This means that the same valve can deliver a wide range of concentrations. As the valve does not have to be replaced each time the prescribed oxygen concentration changes, the changes can be made quickly. It also means that different valves do not have to be held in stock by the hospital. The Silente adjustable Venturi can be set to concentrations between 26 and 50% and incorporates a twist lock mechanism to prevent inadvertent concentration changes. As with a fixed valve, attach one end of the oxygen tubing to the valve spigot and the other to the oxygen flow meter. To select the desired oxygen concentration, ensure the range selector sleeve is in the appropriate position. If the desired concentration is in the 26 to 35% range, Then ensure the range selector is in the white area. If the desired concentration is in the 40 to 50% range, then rotate the oxygen concentration selector to 35%. Pull and rotate the oxygen range selector to the purple area. Select the desired oxygen setting by rotating the oxygen adjuster. Set the oxygen flow meter to the flow indicated adjacent to the oxygen concentration. The materials used in the manufacture of eco-range oxygen therapy masks mean that there is a significantly lower impact on the environment. They also have a new lightweight design, incorporating a soft face seal that provides a high level of patient comfort. This section covers the type of humidifier that delivers cool humidification. Fink and Hunt in Clinical Practice in Respiratory Care describe the two most commonly used devices in this category as follows. A humidifier is a device that adds molecular water to gas, whereas a nebulizer produces an aerosol or suspension of particles in gas. Bubble humidifiers use the bubble-through humidification process to bring dry oxygen gas to ambient levels of humidity. The gas is directed into the water bottle where it is broken up into small bubbles. These gain humidity as they rise to the surface of the water. The absolute humidity of the gas varies with flow rate, water temperature, bottle size, and volume of water in the bottle. Bubble humidifiers are most commonly used with low-flow devices such as nasal cannulae and medium concentration oxygen masks. Some models incorporate a pressure relief valve designed to prevent excessive pressures building up in the bottle should the oxygen tubing become occluded. Operation of the relief valve may also activate an audible warning, drawing the attention of the user to this problem. The head of the bubble humidifier may also incorporate a universal screw thread. This permits the use of a bottle, which can be refilled with sterile water, or the use of pre-filled sterile water bottles.